Good evening, everyone. My name is Carolyn Brown, and I am the Senior Associate Director of Development and Community Engagement at Penn Medicine's Bassler Center for BRCA. On behalf of the Bassler Center's Young Leadership Council, I would like to welcome you to tonight's panel discussion, BRCA 101. The Bassler Center's Young Leadership Council is a dynamic group of 128 men and women in 28 states, Australia, and Canada. The opinions and experience shared tonight are the panelists' own and do not represent those of the Bassler Center, its Young Leadership Council, or Penn Medicine. You should consult with your healthcare team should you have any questions about the specifics of your health and medical plan. Thank you to our panelists for joining us this evening for this important discussion about BRCA gene mutations, what it means if you have one, how to go about finding out if you have one, from the patient perspective of two of our YLC members, Lewis Abrams and Jourdan Cohen, and Bassler Center genetic counselor, Kelsey Spielman. Suzanne Zuppello, who will be moderating our panel this evening, is a freelance journalist living in Long Beach, New York. Since learning about her BRCA1 mutation in 2015, Suzanne has been involved in the BRCA community. She joined the Young Leadership Council in 2016 and became the group's co-chair in 2018. And with that, I'd like to turn it over to Suzanne.
Thank you, Carolyn. On behalf of myself and my fellow co-chair of the YLC, Erica Stallings, I'd like to thank you all for attending tonight's discussion, which will dive into what the BRCA genes are and what it means to carry a mutation. Before we begin, I want to note that because the target organs of the BRCA mutation depend on whether somebody has male or female anatomy, we're going to be using this terminology as we discuss, but we want to recognize that all genders and gender non-conforming individuals can be a BRCA mutation carrier. So I would like to introduce our esteemed panelists. First is Lewis Abrams. Lewis is an in-house attorney at a financial services company in Philadelphia, where he currently resides with his wife, Jenny, his dog, Pierre, who make an appearance tonight, and they are expecting their first child anytime now. So we'll also excuse Lewis if he abruptly leaves the Zoom tonight.
Thank you.
In 2019, Lewis learned that he carried a BRCA2 mutation. This diagnosis came after Lewis lost his older sister, Marion, to BRCA-related breast cancer. Since then, Lewis has been dedicated to raising money for BRCA-related research in conjunction with the Bassler Center's Young Leadership Council. Our next panelist is Jourdan Cohen. She's a digital marketer working in fashion and luxury space across several women's media brands. She is a 2011 graduate of Brandeis University with a BA in American Studies. Jourdan is a member of the Bassler Young Leadership Council and has written about her experience with having a BRCA1 mutation and undergoing a preventative double mastectomy for the Bassler blog and for Elle. Kelsey Spielman is a board-certified genetic counselor who works at Penn Medicine's Bassler Center for BRCA. Kelsey provides cancer risk assessment and genetic testing for individuals and families affected by cancer. She also works as a genetic counselor on research studies at Penn that are studying alternative models for delivery of genetic testing. So thank you all of our panelists for agreeing to share your knowledge and experience with us this evening. So with that, we're gonna begin with a question for Kelsey. Kelsey, can you start by sharing what BRCA genes are? Does everyone have a BRCA1 and 2 gene? And what does it mean to be a BRCA gene when a BRCA gene is mutated?
So BRCA genes are referring to BRCA1 and BRCA2. Those are two genes that we all carry, and we have two copies of every gene in our body, one from mom and one from dad. And BRCA genes work to protect the body from cancer. So when we talk about someone having a mutated copy of the BRCA gene, we mean that they have a spelling error or some change to the gene that causes it not to function properly. We can think of this as having almost one less coat of armor in the protection against certain types of cancers in the body. This does not mean someone will develop cancer, but they are at a higher risk for certain types, like male or female breast cancer, ovarian cancer, and prostate cancer. Our BRCA carriers, because of these higher risks for certain cancers, may benefit from options like enhanced screenings, medications, or risk-reducing surgeries that should be discussed with their physicians. BRCA mutations are typically inherited from either side of the family, so that's mom or dad's side. And siblings and children of BRCA carriers also have a 50% chance each of carrying the mutation. So this information actually can have impacts on families and not just individuals.
Thank you. And so Kelsey, with all that in mind, can you explain a little bit about the role of a genetic counselor when it comes to testing for a BRCA gene mutation and what comes after those test results are received?
Yeah, sure. So I mean, my short response would be genetic counselors we're providers who have specialized training in genetics as well as counseling. When we see a patient for testing, we review personal and family history information, and depending on that information, we determine appropriate testing options. We can then facilitate that testing for the patient. We are also the providers who disclose the results and help them kind of understand the results and what it would mean for them and their family. And then we can refer appropriately to providers for medical management recommendations and connect them with support in the community. But I mean, to expand on that a little further too, when you say, what's our role in testing, we may actually see patients for a number of reasons. We may see someone who's has cancer and their treating oncologist referred them because this information may have an impact on surgical decision making or treatment decisions. There's actually targeted therapies that are available for individuals who have BRCA mutations. We may see someone because they have a family history of cancer and their doctors ask the appropriate questions about family history and then determined that they needed further assessment. We may see someone because they already have a BRCA mutation in the family, or we may see someone who has a BRCA mutation and wants to better understand what this means for them and what their next step should be. And so, I think our discussion is going to depend too on the person's situation and their, tailored to their needs. There's a lot of attention now too on direct-to-consumer tests like 23andMe. And I'm sure we'll talk about, that as well. But, I think these are conveyed as being highly accessible and cheaper options for getting genetic testing information. And we just want to make sure that people are aware that as a Vassar Center for BRCA genetic counselor, our stance is that genetic counseling should always be done prior to testing if possible. And that's just because we want to make sure patients are making informed decisions about testing, that they understand what testing is being done, that they have the correct testing, which is obviously a huge thing, but also that they have, a plan in place if, the results are positive. So just a little bit more, because I think there are certain questions that come up when we talk about genetic counseling, and that's insurance coverage and cost. And we do have those conversations with our patients as well. At Penn too, most of our patients don't pay more than $100, but at maximum $250. And you could argue that that's at least equivalent to what's out there with direct-to-consumer testing, but you're getting quality care, personalized care. So I'll open up, the conversation for some of the other panelists, but those are some of my thoughts. And when you ask about like genetic counseling and my role in testing.
Yeah, and just really quickly before we get to the next test, I think everybody will benefit from the answer to this, which is during a pandemic and so many things are happening virtually like this event. Are people still able to get counseling? Are new patients being able to find a counselor at Penn or, I know you can only specifically speak to Penn, but other facilities as well. And is like virtual counseling encouraged if people can't make it in person?
Yeah, so virtual counseling is actually something that the field has been doing for a while now too. We know that there, is a shortage of genetic counselors, and there's also people that can't make it to appointments. They can't take the time off work to make it to an appointment. And so telephone counseling is absolutely an option. We actually have a telegenetics program at Penn, and there's some resources that I can talk about later, I can talk about now. The National Society of Genetic Counselors is a good resource for individuals who are interested in telephone counseling, and they can find a genetic counselor through there as well.
That's great. And I know that there are going to be so many questions specific to genetic counseling, and Kelsey has graciously agreed to answer the questions that we don't get to this evening in follow-up videos that you guys will receive. So if your question isn't answered, don't worry, we will try and get to it as best we can. So with that in mind, the TLDR of that is that your conversation with a genetic counselor is going to be super specific to your family history, what's been going on in your life, what, somebody in your family has tested positive for a BRCA mutation. So with that note, Jourdan, you mentioned that you learned about your BRCA1 mutation about 6 years ago. I think you mentioned you inherited it from your dad. Is that correct?
Mm-hmm. Yeah.
And when you learned about that you're a mutation carrier, did you undergo genetic counseling prior to that? Did you undergo genetic counseling after that? What was that experience like for you?
So I didn't, and it's honestly one of the things I wish I had maybe done differently in the process. I kind of went into testing really blindly. I had a new doctor who was taking my medical history, and I said, I had a grandmother who passed away from ovarian cancer, and she was like, oh, and looking at your last name, it sounds like you're also, Jewish. Can I talk to you about this gene and maybe consider doing testing today? And I was very, naively like, sure, whatever, it's a blood test, let's get it done so I can get back to work. And came back positive. And it took me a while to sit with the information and start thinking about how I wanted to process it and handle it. And in that time, in hindsight, I really would have benefited from seeing a genetic counselor. So it's something I recommend to anyone else who's considering testing at this point. But, fortunately, I had doctors who kind of held my hand and guided me through the process. And I was very lucky to have access to information, even though it was not, maybe the right way to go about getting it.
Yeah, and that's really interesting that you brought up that your last name sounded Jewish and that was a factor in your testing. Because I know from my experience, I first asked about BRCA testing with my doctor, and she told me you're not of Ashkenazi Jewish descent. And so, Kelsey, one thing I think we've touched on before, and if you want to quickly elaborate on this, is that we kind of think of we associate the BRCA genetic mutation with people of Ashkenazi Jewish descent, but that is a misconception that they are the primary group or the main group that carries this mutation. Can you elaborate on that a little bit?
Yeah, I think you stated it pretty nicely there, which is that these mutations can be found in individuals of all racial and ethnic backgrounds. And I agree, I think it's a misconception that it can only occur in white women or Ashkenazi Jewish women, and also that it can be passed on from dad's side of the family. So Jourdan, you spoke to your experience. We do see patients too where dad's side of the family did have some cancer history, but the providers weren't asking about dad's side of the family. So that's another important thing too, to make sure your providers are asking about both sides of the family. Ashkenazi Jewish individuals do have a higher chance of carrying a BRCA mutation, but when there's a personal family history of cancer, or just concerns, someone might not have a lot of information on their family history. Maybe they're adopted and they want to gain this information to make informed decisions for themselves. They can absolutely still pursue genetic counseling and testing.
Awesome. Thank you, Kelsey. And you brought up another really good point, which leads me to my next question for Lewis, because so many of our Young Leadership Council members are women. We associate the BRCA genetic mutation with women primarily. We mentioned in your introduction that your sister had lost her life to a BRCA-related breast cancer. So can you speak to a little bit about your experience as a male BRCA mutation carrier, what that's been like, what different surveillance or counseling you've gone through, which is obviously different from the women in the group?
Yeah, and I think it's a good point, and I think the focus is on women, in BRCA research and, at the center in general, and a lot of BRCA-related activities, in that it afflicts women at a higher rate. And then there's the whole notion of preventative surgeries. So when you look at the statistics, my sister, we found out when she developed breast cancer, this is my sister that passed away, that she was a BRCA2 mutation carrier. And at that point, I looked up what if I'm also a carrier or have the mutation, what would that mean? And it seemed to me at the time, it was just like a slight bump up in my incidences of cancer and my chances of cancer. And following me looking that up, I never went and got testing. And this is not something that should be repeated, but I want to share sort of my journey on how I got there. So I never went and got tested. My mom got tested. She found out she had BRCA2 mutation. My other sister had the BRCA2 mutation. Then she started undergoing preventative surgery. And at that point, I still didn't get tested. And wasn't really till my now wife was really encouraging me to go get tested. And when I did sit down with a genetic counselor and realize it's foolish in a way to dismiss it. I think one thing, just having personally witnessed a BRCA-related cancer, and this is not a scientific basis, but that they are very aggressive. And when you sit with the genetic counselors, which I did at the Vassar Center, they will explain to you just some preventative things you can do as a man, which are not a huge burden in any way, but something that I think is very good. And I want to plug the genetic counselors like Kelsey, something very good to keep in mind. Knowing that these cancers can be aggressive, you want to keep these things and be aggressive in preventative care. And then it's also, I think, really important in family planning. Then after I found out my diagnosis, my wife and I were planning to have a baby. So it was also good in that regard. So I think men really should take it seriously. The burdens on men in this instance, like without the preventative surgery and things, could be a lot less, but something that's very worthwhile.
Yeah, that makes a lot of sense. And, you know, at the Vassar Center and the YLC specifically, we've had a few conversations and panels around fertility and family planning, and we really have focused on the female perspective. So as a new father, are you open to sharing a little bit about some of the discussions you and your wife had when it came to, you know, deciding to have children? Did you just, you know, talk about IVF and PGD testing? What was that like for you both?
Yeah, and I think it is something that hopefully you have a partner who is understanding in a way. I didn't come into it cold, so to speak, because my partner was there when my Jenny, who might be listening, was there when my sister passed away. So then I got tested. She encouraged me to get testing. So it wasn't like cold in a way where you're dating someone who's never heard of it and you have to explain it. So we did have the background there, but it was discussions we had, and it's good to have someone, a partner who's open to the discussion. The topic of IVF did come up, or whether we wanted to avoid, you know, that issue and genetic testing, and ultimately we decided not to go the IVF genetic testing route. But I think it really is a personal decision as to what's important for your family. I will say though, my wife's very understanding, but I think there is some trepidation about talking to someone about it so cold, so to speak, or someone you're in the dating world and you have to address it in some way. And what I found, I think in my life, if I speak to how you frame the issue, can be very, can open up a door for a lot of people. If you start out saying there's higher incidences of certain cancers in my family, people very understand. I find that to be an access point for a lot of people. And then you start to explain what BRCA and the genetic mutation. I find that to be a lot more effective in explaining people, rather than if you start with BRCA, people think you're talking about a computer or something and no one's ever heard of it. So, and that's my dog screaming. So I might have to go on mute, but that's
okay. That's a perfect segue actually to my next question for Kelsey. So thinking about these tough conversations that BRCA carriers have to have, and, you know, for people who either don't know about genetic counseling, which you already spoke to a little bit to Kelsey, or have access to it, like, what is your advice to them? What can you expand on that role of, like, are you, like, I hear the word counselor and I think almost like therapist, the person who's kind of going to guide me and maybe give me some advice on how to have these tough conversations. And like Jourdan, I never met with a genetic counselor prior to learning that I carried a BRCA1 mutation. They actually told me all the risks for a BRCA2 mutation when they said I had a BRCA1. So it was a really confusing day. And so I'd love to hear a little bit more about, those types of conversations that maybe you have with some of your patients at the Vassar Center? And is it beneficial for somebody like me or Jordan who have never met with a genetic counselor to start seeing one as decisions around family planning or dating even, or, you know, talking to our parents that they should be getting screened, or, you know, my brother hasn't gotten screened for a genetic mutation? Like, what is your role there, and how can people access that type of counseling with you?
Yeah, absolutely. So, I mean, I'll speak to maybe the latter of that, which is, you know, would it be beneficial for someone to meet with a genetic counselor after they've already received their results, even after they've had exams or surgery? Oh, sorry, Louis, were you going to mention something?
No.
Oh, okay. I thought I heard something. So, and yes, I do think it would be beneficial. You know, I do think that in general, meeting with a different provider can also allow you to gain a different perspective on seemingly same information. And in addition to that, you just mentioned this, Suzanne, but when you're going through the process of making like important medical decisions about screenings or surgeries, you're navigating kind of the healthcare system and insurance. I actually think genetic counselors can kind of help slow things down and address maybe some of the questions or concerns that haven't yet been addressed. And things like, you know, how and when to tell my family, that comes up all the time. And genetic counselors can help strategize with you. You know your family best. You know the family dynamics and the family relationships. But we do have resources we can provide, letters and email templates, for example. But also, I've done mock sessions with my patients, right, where they felt like the practice, and anticipating those responses from, you know, their family members was really helpful. So that's something we can do. And then, of course, family planning as well, and kind of what someone's options are, and helping them maybe you know, figure out what is important to them and what the, you know, what the best step for them is. And then we can plug them in with the appropriate providers to take those steps.
Yeah, and if I could add on as to my experience, that the genetic counselor can really be a life coach. They give you a whole plan. It's like going to a fitness trainer and got like a whole nutrition and all that stuff. No, but what doctors you should see, how often, and family planning. Here are your options. Here's brochure. So it could be disorienting getting a you know, a positive diagnosis, particularly if your family doesn't have a history. And I think they can orient and guide you through that process.
Yeah, can I just jump in and add kind of along the lines of what Louis was saying? I think certainly when I got my information back from the doctor who did my testing, it was a lot of information thrown at me at once. It was like, here's this random string of numbers that mean you have a mutation on this particular gene. Here's a doctor at this hospital who you should go see. Here's a doctor at this other hospital who you should talk to about these other things. It's a lot to process, and you're also handling sort of the emotional weight of thinking about what it means in terms of future planning and things like that. And to have someone sort of hold your hand along the way, certainly for me would have been really helpful, because I kind of like put everything on the back burner for a while, even after getting, you know, my results back, because I just couldn't process all of the information at once.
First, I want to give a quick shout out to Jordan's dad, who is in the chat right now.
Hi, Dad.
Yeah, I just saw Jordan's dad.
I
Hey.
hope the sourdough is cooking in the background over there. But I think Jordan has brought up a really good point too, which is and one that the YLC kind of serves is creating community and helping provide information as well. Though, like, you know, Jordan and I, for instance, connected at like a mixer event for BRCA mutation carriers. And so we were able to share information about our lived experiences and medical choices. However, there's still like that gap sometimes where you didn't know that something was an option, or you didn't know that like a piece of surveillance was something that maybe you should be doing or monitoring or talking about or thinking about or whatever. And so that's sort of where a genetic counselor has their list of, these are the vital pieces of information that we can walk through, and we'll slow it down and we'll make sure you understand, versus the, here's the list of the doctors and here's the list of your mutation, and, you know, shove you out the door and you're okay.
Yeah. I'll also add, you feel like if you're seeing like a great oncologist or someone like at the Vassar Center, you feel like you're holding them up. Not that they would ever, they're all so nice, but I feel like I'm holding them up sometimes. Like they could go be saving someone else's life. They're dealing with me. So I maybe that's just my own neuroses, but I think genetic counselor, you feel like that is their job to talk to you, and you're not preventing them from doing anything else. So I something else to think about.
Yeah, and going back to Jordan's dad's comment, because it leads to my next question for Kelsey. I'm just going to keep bringing Mr. Cohen up, not just because he's a great man, but he asked, and what kinds of cancers specifically affect male BRCA or male-bodied people with male anatomy, BRCA mutation carriers. And so, Kelsey, if you could speak a little bit to that, and then go into how your counseling of male-bodied or female-bodied patients differs and what those conversations look like.
Yeah, sure. And I think that I'll probably address that as part of the question about, how is it different counseling someone who is female-bodied versus male-bodied. So kind of speaking to that, in terms of some aspects of counseling are going to be the same. So like asking about the family history, addressing like how this information, how they got this information, things like that. But in terms of, I just want to make a disclaimer here. I'm not a physician. I don't, manage cancer risk. I don't diagnose or treat cancers. So medical management should always be discussed with a physician, and the next steps and protocols that we go through are guidelines. But those are going to be personalized to you based on different factors. That's like the types of mutation and the associated risks that you have, the personal family history, as well as Suzanne mentioned, like your anatomy. And we actually do ask questions, about what body parts people have. Do they have female versus male breast tissue? The anatomy is different, and so are the cancer risks. Do you have a prostate? Do you have ovaries? These are all really important because we want to make sure that we're keeping our patients healthy. For those who are non-binary or transgender, a lot of these guidelines are not going to fully address some of the questions or concerns that might come up for those individuals. So I think that also highlights just the importance of seeing a genetic counselor and a provider. In terms of, for those, who, I think I'll address Jordan's dad's question about men first. So men people who have male breast tissue are at an increased risk for male breast cancer. And male breast cancer doesn't get a lot of attention because it is rare in the general population, but for our carriers, they can be up to a 10% chance for developing male breast cancer. And there's things they can do about it. Mammograms are not just for women, but also we do typically start screenings for men around the age of 35, and that would include like regular clinical breast exams by a provider. And again, mammograms can be done for them as well. Louis mentioned this as well, but those who have a prostate are at a higher risk for developing prostate cancer and a more aggressive prostate cancer, and we can see it at earlier ages. So that really stresses the importance of talking about prostate screenings, blood tests, and prostate exams with your provider. Men and women carriers are also, potentially at a higher risk for developing other cancers like pancreatic cancers. And I think I saw that in the chat as well. Specifically BRCA2 carriers, at our high risks, and especially if there's a family history. Pancreatic screenings are not something that's typically done, as a standard measure in the general population, but should definitely be discussed with the provider as an option if you are a BRCA carrier. Also for BRCA2 mutation carriers, there's higher risk for melanoma. Now coming back to kind of those who are female bodied and some of the associated risks there and what the options are. So for female breast tissue, we can, Jordan spoke to kind of her experience in making this decision, but there's the option of screenings or surgery. And screenings typically start around the age of 25, and we do breast mammograms and breast MRIs more frequently. Surgery is a risk-reducing bilateral mastectomy, which can be done with or without reconstruction, and there's a ton of options there as well. But there's not one option that we recommend over the other. It's definitely a very personal decision and one that should be discussed in detail with your physician and an oncologist. For ovarian cancer screenings. Compared to breast cancer screenings, ovarian cancer screenings are not as effective at capturing ovarian cancer at early stages. So at the current time, we actually recommend the fallopian tubes and ovaries are removed after one's done having their family and as close to menopause as possible. But the timing of that intervention is going to depend on a lot of factors. So that should also be discussed with, a physician, so that they're taking into account, family history and maybe other factors that are important to decide when to do that intervention.
Great, that's really helpful, Kelsey. And somebody in the chat mentioned that they are a male BRCA mutation carrier and they have to remind their regular doctor to do a breast exam. Is it recommended? I can only speak from my experience as a woman that I was, immediately sent to a breast surgeon, and that is my primary care provider. Is it recommended that men also are getting these exams from oncologists, breast surgeons or breast oncologists, instead of going to their primary care physician and having to remind them, because primary care physicians don't often, aren't necessarily experts in a specific genetic mutation and what that mutation requires?
Yeah, so I think the importance there is that your provider is familiar with doing male breast exams and BRCA mutations. And we do recommend that men are seen by an oncologist, especially in developing this personalized plan for them. And I think that they can kind of point you in the direction as to like what providers they might refer to that they do trust for their patients, so that you can address that, because I do think that's important. And I think it's okay to ask your provider, are you familiar with this? I would appreciate you looking into this. Let's do it together. And I know that all providers may be welcome to that, but I think that's important.
That makes a lot of sense. And before we go to my next question for Jourdan about her decision to undergo a preventative bilateral mastectomy, there have been a couple of questions about at what age do most physicians recommend breast cancer surveillance start? And I know the Vassar Center has some guidelines on age for counseling, age for screening, and maybe even age for when surgery might be appropriate. Can you speak to that, Kelsey, at all, or is that maybe a little too niche and requires more family history and specifics?
Typically breast screenings would start around the age of 25. I know there's a question in the chat as well about, I thought it was a question about testing for children. So I want to come back to that, because we don't typically test minors. And one of the reasons is because, for women specifically, screening doesn't start around the age of 25. Now, questions about when to do, like specifically, again, implementation of this, all of these things need to be discussed with the physician, but when to do something like surgery, there's a lot of factors that are going to go into that. So I would defer to our physicians, but the patient themselves as well.
Right. And again, to emphasize, it's a deeply personal choice when and if you decide to have a preventative surgery. They're major surgeries and are not to be taken lightly, which brings me to my next question for Jourdan. So how soon after learning that you had a BRCA1 mutation did you decide to have surgery? What led to your decision, since we know from Kelsey that surveillance is an option for women as opposed to undergoing the preventative surgery?
Sure. So it took me about 2 years to make the decision. And then from the time I made the decision to the actual date of the surgery was almost another full year. And part of it was definitely, I am a very anxious person by nature, as I think anyone on here who knows me can attest. And the feeling of going in every and screening and stuff and not knowing if this time was going to be bad news or something like that, just that to me felt much more anxiety inducing and stressful than being proactive. And I think the other half of it was also, I am someone who really likes to have control over situations. And it felt very important to me that to do these surgeries was something that I made a decision to do, rather than, getting news from a doctor and being told like, okay, now that choice has been taken away and you have to do this. So to do it proactively and to really, feel like I was confident in the choice and that it was right for me at that time was really important, and I think made the process a lot easier.
And how did you feel post-surgery? Did you wake up and you were like, a weight is lifted, I'm not feeling anxious, I'm feeling really good about this choice? Do you like, I mean, I think it's probably normal to still go back and forth. Like maybe I would have been in that 13% group that didn't get breast cancer, but has a BRCA mutation. What has that been like post-surgery?
I mean, so without getting into, my full medical history, I think I had some surgical complications coming out of my surgery that made it kind of atypical and not necessarily the most straightforward process that I think most people are kind of prepped for when they go into a prophylactic surgery. All of that being said, I don't think I've ever questioned the decision to do it. I think I would have gone through all of that happily to know reduced my risk that much, and that I was able to take my health into my own hands like that. So really,
Great.
For a moment, I regretted the decision. It was what was right for me.
Great. And I could speak personally that I know that you had a great team of surgeons behind you and a very supportive team of surgeons. Jourdan and I share surgeons. So we report back to each other when we visit them, which is another great part about this community is that there are people you can get resources from, like surgical, surgeon recommendations and things like that. We've covered a little bit about this before, Louis, in terms of like your family planning decisions. Are you actively in any surveillance programs, or are you, going to your regular doctor and getting breast exams? Are you feeling it on the first, like many women do? I'm curious a little bit about your experience there.
Yeah, so I had a plan that I worked through with my genetic counselor, one going to a doctor at the Vassar Center, and then, or the option two, and just was to go to my primary care doctor to get the breast exam. And then also when I'm 40, I believe, go start getting prostate exams. And then I have to go to the dermatologist once a year. So it's not for just, to analyze everything. So it's not too big of a burden in any way. I just got to keep myself on my routine. So it's something that is on my mind, but not constantly. And I will add to what Jourdan spoke about. My twin sister underwent surgery, and it was a tough decision for her. And speaking to my family, but she had a support system, but it wasn't straightforward either. There were complications which can happen in surgery. So I want to stress sort of there's a mental health component to this, or emotional component, I should maybe say, that whether you're planning, whether you're family planning, whether you find out a kid is a carrier, that, just to consider that, and if there are any resources you have available to that regard, that you should use those.
Yeah, absolutely. Community is really important. People with shared experiences are really important. Genetic counselors are really important.
YLC.
Yeah, exactly. Just the sharing of information and understanding the weight. Like you said, I can speak really quickly and personally that, when I woke up from my mastectomy and I was recovered and I had breast implants and clothed, I looked just like my pre-mastectomy self. All of my friends were like, it's over now. And in my mind, it wasn't, because there's still so much more. And like you said, Louis, it's not on your mind all the time, every day, all day, but it is on your mind. And it's something that, you are, consistently need to keep as part of your routine and be, just monitor. And so with that in mind, our last question before we get to our audience questions and some of the ones that have been submitted in the chat here is both for Jourdan and Louis. What is something you wish you knew before undergoing testing for your BRCA mutation, or before making any decisions around your healthcare? Are there any resources you found helpful or wish you had available to you prior to making any decisions about genetic testing?
Jourdan, want to go first?
Sure. So one thing which I think I already touched on in the beginning is I wish I had gone to a genetic counselor and that I had been told that was an option, sort of both before and after testing. I think that really, again, would have made the process a lot easier and would have helped make some of the decisions that were in front of me a little bit more clear. Conversely, I would say one thing that was not helpful for me was kind of falling down a Google rabbit hole with research when I found out I had this mutation and scaring myself. I remember, you know, I signed up for all these Facebook groups, and I think in some ways it was really great to know that community was out there, but those are, you know, Facebook groups where people are sharing their like 1 in a million kind of scary story with BRCA. And I think it's really easy, especially when you're first learning about having a mutation, to sort of scare yourself into not taking any action because it all feels really overwhelming when you're confronted with it like that. So staying sort of away, self-research, I think would have been a very helpful option early on.
Yeah, Kelsey, do you recommend that folks stay away from Dr. Google and the horror stories that might be out there? And have you actually had anybody come into your office and say, look at what I just Googled, I can't do this?
Yeah, I mean, I think, so here's the thing. I think Google can be a good tool when you know where to go. So things like the Vassar Center for BRCA, Mayo Clinic, these resources that have been well vetted by, you know, patient advocates, professionals. I think that Facebook blogs and posts and things like that can do exactly what Jourdan mentioned. I also think that like support groups, I think like peer-to-peer connections can be really helpful, but it is important to kind of keep in mind that those are individual stories, and there's a lot of factors that go into this. Again, you know, just another reason, you know, might be helpful to see a genetic counselor. You know, some of our patients are willing also to connect with other patients. So if we feel like two people would get along well, or kind of in seemingly similar situations or kind of life situations, we might be able to help connect them. But yeah, I mean, I think that it's just important to know kind of where to go. And I wanted to mention too, like in terms of accessibility of genetic counseling and testing, I mentioned the Vassar Center a couple of times now. And we do actually have 2 initiatives as well, I think, that are important to mention. That's Latinx and Black and BRCA. And these are initiatives that are focused on providing tailored resources and outreach to the Latino community and Black community respectively. I can actually include some of these links in the chat while I'm talking about that. You know, I realized I can actually put those in there. And then the National Society of Genetic Counselors, I mentioned, is a place you can find a genetic counselor. So I think those are important to be aware of as well.
Yeah, that's awesome. Thank you, Kelsey. And Louis, that's the question I asked Jourdan. Anything you wish you knew, wish you asked, wish you know, had in your world before you decided to undergo testing? Obviously, your experience was very different from things, having other family members test positive prior to you testing positive.
Yeah, and I think for me, I delayed in getting testing. Unfortunately, nothing happened to me during that period, but I think I was a denial or dismissed the risk in some way in my head, and really dragged my feet on getting testing. So I wish I'd done that sooner. I wish I talked to a genetic counselor sooner. You know, again, I want to thank my wife, who was really on me to do it. One other thing I think that is a huge component of this is the emotional component again, that whether you're facing surgery, whether you find out you're a carrier, whether you are a parent who feels like they passed on the mutation, there's just an enormous emotional component to it, and it could feel, we're dealing with cancer, so things feel very we're going to talk about the physical aspects, preventative surgeries and things, but I think that's something that we got to be mindful of, even if, for example, a son or daughter won't get tested. I mean, these are just components, and, you know, to the extent there's any support resources you have, I'm sure, Kelsey, you'll let me know that Vassar Center can recommend resources in that regard, that just something to consider as part of the pie, that you know, there's more to it than just the physical component, which obviously becomes the most in a way.
Yeah, and Louis, soon I think you could join our Parents Leadership Council, which we also have at the Vassar Center. You know, from my own experience, I think there was a lot of guilt from my dad. He felt guilty for passing this genetic mutation onto me, and it's not his fault. Like, we didn't know when I was conceived in 1987, like, you know, the BRCA mutation is new relatively. The discovery of it is, you know, I think around the same age as me. So that there's still a lot of new information coming out, and it's not anybody's fault for passing that on. And so being able to have those conversations, I think, is really important. And I'm really grateful that the Vassar Center started a parents leadership group as well, so parents can have these conversations.
Yeah, and on that point, it's one parent usually. I think you could trace it to, like it's on my mom's side of the family. So it's this odd. It can create this odd dynamic in a way. So yeah, it's certainly something to keep in mind for everyone involved.
Cool. Well, thank you all for answering those questions. And we don't have a ton of time left, so I do want to get into the questions that have been submitted and also in the group. I know that somebody asked about a hysterectomy and a wash of the abdomen. I think we're going to defer the answer to that question to just speaking to your oncologist about that. That is not a question that any of us on this panel are, full, as Kelsey mentioned, she is not an oncologist either. So we are not the experts, we are not the people, but it is, asking that question and knowing what that means is definitely important. And so props to you for even knowing to ask that. Really quickly, I'll also just say, somebody asked Jordan and I who our surgeons are. We live in New York City. Sorry, Jordan, that I'm speaking for you. We both go to Memorial Sloan Kettering. Our breast surgeon is Mary Gemignani, and our plastic surgeon was Babak Marara. And I personally also see a gynecologic oncologist there, Dr. Abu Rustam, who is wonderful. And so, yeah, can't recommend that enough if you're in the New York City area. It would be a little bit hard for us to drive to Philly and for our surgeries and screenings and stuff. So let me get into the questions that have been submitted here. So for Lewis and Jordan, what are some of the challenges? You guys have talked about this a little bit, but what are some of the challenges that you've faced, as well as helpful advice you've received after undergoing genetic testing and finding out that you have a BRCA mutation?
You want to take this one first, Lewis?
Yeah, I'll take it. Some of the emotional impact, as I said, and luckily, I think the immediate thing was not only figuring out what doctors to go to, but having that discussion with my wife about family planning. So I think with all these discussions, the better, you're open about it and upfront about it. I think the better. Obviously, it's not for every single situation, but that was really the sort of next challenge in my mind of how we're going to address this. And, for example, at my genetic counseling, I didn't even realize that there was this genetic testing option for IVF until I sat down with a genetic counselor. So I went the opposite. I didn't go down a Google hole, which maybe I should have, and probably it did sort of nothing before I walked in. But that's really is information and sort of having these discussions with the people you need to.
Jordan, what about you? Good advice.
So I think, oops, sorry, you froze for a second there. Can you repeat?
I said either good advice or challenges you faced since undergoing testing.
So to Lewis's point, I think it's a lot to emotionally grapple with. And I think at certain points along this process, there are things I could have handled much better from an emotional standpoint, as I think my parents who are here can attest. Things that I think I did right were reaching out to people in my community who had a BRCA mutation, and not necessarily from a medical standpoint, but more from a day-to-day, life impact standpoint, hearing their experiences. You mentioned you and I share surgeons. That's because you recommended them to me and told me what a positive experience you had. And I was dealing with surgeons who I, was not having that experience with at the time. Or, talking to other women who had undergone preventative surgeries, even in the sense of like, here's what's really helpful to have after surgery. Here's what they'll try and tell you to buy on all these websites that you don't need, was really helpful. And just to kind of hear what life was like for people after their surgeries, of like, sometimes I don't notice when my bathing suit has slipped off, or, here's a thing that's really great. I got to wear all these clothes I didn't get to wear before. Kind of made it a lot easier to mentally process and get more of the sort of like lighter side of things.
Yeah, that makes a lot of sense. And I'll say personally, like one thing I wish I knew is with all the different options for breast reconstruction, You know, doctors have their preferred methods and don't always share, you know, the other options for you. I kind of heard about two different options. One was off the table because of just my size and that I haven't had children, things like that. But I wish I knew like all the different styles and options and whatever was out there. And I think we are going to be eventually hosting a panel that's just on breast reconstruction, answering a lot of those questions about the different options that are available to people who decide to undergo reconstruction or don't undergo reconstruction after a mastectomy. And the next question is for you, Kelsey. So for somebody whose parent, in this question specifically, a mother is not a BRCA mutation carrier, but did have, I believe, both breast and ovarian cancer, should that person undergo genetic testing?
Yeah, so I think I'm glad that question got asked, because the answer is yes. I think that it would be really beneficial to see a genetic counselor. There's also been advancements in the field. So, you know, if you had testing a decade ago, for example, there are technologies that have improved our ability to capture certain mutations that we might not have been able to back then. There's also other genes that can be associated with a family history of breast and ovarian cancer that might not have been tested for. So I think that is really helpful to see a genetic counselor. Negative testing for someone who is unaffected is considered uninformative unless someone in the family has had cancer and had testing. So that's also an important distinction, all of which a genetic counselor can help kind of work out with you.
That makes a lot of sense. And the next question is also for you, Kelsey, and Lewis sort of touched on it earlier, mentioning that your mutation often comes from one parent, but I'm sort of answering this for you, but I've actually met somebody who carries both a BRCA1 and BRCA2 mutation. She inherited from one parent and one from the other. And so this question is, can both of those genes be mutated?
Yes, they can. It's not necessarily like twice the risk. So it's not like you have 100% chance now for developing breast cancer, but definitely personalized recommendations, you know, discussing those with your genetic counselor and your physicians.
And then a lot of the next questions really focus on testing of people with male anatomy. A lot of sons out there, curiosities about when sons should get tested, should they get tested, what conversation should they be having with partners or their parents or whatever. So it sounds like a lot of mothers are urging their sons to go out and get tested. Kelsey, what is your advice to those parents on what age that a male, a son who maybe has siblings or a parent who's tested positive for a BRCA1 or 2 mutation, when should they get tested, and what's your advice for them to maybe get those sons in the door?
Yeah, so I think that there's a lot of parts of that question too. You know, one of them is addressing like sharing this information with the men in the family. So of course, there's going to be focus on women in the family, but making sure that you are addressing this to men as well, because again, they can really benefit from these diligent screening regimens, as Lewis spoke to. Also, Lewis spoke to family planning. So even though screenings might not start until around the ages of 35 for men can absolutely have this information to make informed decisions about family planning. And so I think that it's important to, and there's been literature to suggest this as well, but it is important to be speaking to children about BRCA mutations. It's an incredibly difficult conversation to have, but it doesn't mean that they need to get everything at once. It also doesn't mean that they need to pursue testing, you know, at a specific point, but making sure that they're aware of when screenings would start, making sure they're aware of the aspect of family planning. And then again, kind of going to your providers, going to a genetic counselor to further discuss those things.
That makes a lot of sense. And so Kelsey, you also touched on this a little bit before in terms of if you've undergone testing years and years ago, or the advances in testing, what's changed, because we're not only testing exclusively for BRCA mutations, but there are other genetic mutations and markers we found that we know, puts people at higher risk for specific cancers. So if somebody underwent testing maybe a decade or two ago, or and tested negative, or maybe they want to be tested for other genetic mutations because of their family history. Should they revisit that now, and what does that process look like?
Yeah, so I would recommend that they revisit that. The process would be similar to probably what they had, where they're reviewing personal family history, all of which, we would collect updates for. So what changes, are there in the family? Looking at prior test results if they're available, and recognizing that they're not always available, but genetic counselors can actually help track those things down. We have magical powers when it comes to that sometimes. These are all things that can be discussed with someone. And ultimately too, if there's a family history and there's negative testing, again, if there hasn't been an informative family member tested with cancer, we can then appropriately refer them to our providers, our oncologists, where they can talk about things like enhanced screenings or other options to reduce those risks in the family.
Yeah, and that sort of leads to one of the questions that was posed in the chat and touches a little bit about some of what you talked about in terms of helping navigate insurance and coverage for testing. So Marjorie in our chat posed the question that her husband passed away, but so cannot be tested for BRCA1 or BRCA2. I'm assuming, what can a genetic counselor do to help make sure that children are anybody could be tested, but obviously to make sure the test is covered or have the appropriate counseling? What is your advice and that you would give to somebody in that position?
Yeah, so first too, when we're using the phrases children, children can be 40-year-old men and women, right? But we don't typically test minors, and that's because there's not childhood onset cancer risk associated with these mutations, but we do also want to maintain that person's autonomy, that child's autonomy in making decisions for their future as to whether, when it's an appropriate time for them to pursue testing for themselves if they're interested. It is possible, again, that if someone didn't have testing, that they did pass the mutation on. So finding a genetic counselor to have those conversations, making sure that individuals are aware of how this, may impact them. I think the panelists have all spoken to not just like the medical decisions, but the life decisions, the emotional repercussions of all of this. So we want to make sure that we're having a very comprehensive discussion with our patients before they proceed with testing. And then I'm reading some of the chats as they came through. I want to address kind of Douglas Bank, I think, mentioned, anxiety is a real thing. And anxiety and uncertainty is very distressing for a lot of people. But there is a finality in having this decision, made for you as well. So I do think that, it's important that these discussions are open-ended discussions that you continue to have with your providers. The last thing I would want for somebody is they ask a primary care provider, a pediatrician, to do the testing, and all of a sudden they got the results and didn't think through all of the ramifications of that. So again, it is our stance that we do not test minors, but I think that plugging in those who have really bad anxiety related to family history with support persons, social workers, counselors, are things that can be done to try and address that.
Yeah, and Kelsey, age of onset of cancer in a family, does that have an implication on how early somebody should be tested? So if somebody, for instance, my aunt was first diagnosed with breast cancer at age 28 and had a recurrence, a couple of years later. And so does that affect how early somebody like me should be tested, and maybe even consider having a preventative surgery or beginning surveillance because of how young that occurred?
Yeah, so these are all factors that go into when recommendations are made. And that's, again, important in having that dual conversation with a genetic counselor who can kind of express like the options, but we're not the ones to implement those. We're not the ones to ultimately give a personalized assessment and decide on the benefits, risks, and limitations of specific screenings or surgeries. And that's the oncologist, field. So I would definitely encourage like a personalized discussion with the oncologist in that case. But again, even like our recommendations are typically not to start screenings until 5 to 10 years prior to the earliest diagnosis. So for children, this is just not something that they typically would need to know to inform medical decisions.
Right, that makes sense. And the last two questions are again for you, Kelsey, and then we'll wrap up unless any are submitted in the chat. In the meantime, the first quick one is where can the Vassar Center direct any BRCA1 or 2 mutation carriers that if they want to enter any sort of like research study or things like that to have you benefit from them and learn more about these mutations? Where can people look for research studies that they can participate in?
Yeah, so Vassar Center does actually have a section on research studies that someone might be interested in or eligible for. And another benefit of speaking with your genetic counselor is that they might be aware of specific research studies that you can enroll in, either like through Penn, for example, or Jordan and Suzanne, knowing that you're at Memorial Sloan Kettering, there's probably specific research studies there as well.
Yeah, I think I enrolled in like 12 different ones.
I
need to. I feel bad. I'm gonna do it. Yeah.
Give your body to science.
And I want to, sorry, I got a direct message and I want to address this. It's about insurability. There is a federal law called the Genetic Information Non-Discrimination Act that protects individuals from their health insurance using this information against you. So they cannot ask questions, about genetic history, except for the ones they need to know in order to cover certain like screenings and surgeries and things like that. But they cannot use it to like drop your coverage, deny you coverage, raise your premiums. And there's a lot of reforms in the field as well in regards to other types of insurance. So just wanted to address that.
Yeah, that's really helpful information. And that sort of brings us to our last question, which is about racial disparities in genetic testing. I know you mentioned Latinx and BRCA and Black and BRCA, which are both at the Vassar Center. But can you speak to, like, from your experience, what, as a genetic counselor, like the field is doing to make sure that people of color, Black women, Latinx women and men, of course, are receiving adequate counseling and testing and have access to it? Often they're perhaps less likely to live in an area or even know that counselors exist.
Yeah, we know it's a problem. Black men and women are less likely to have had genetic testing. They're less likely to have been referred by their providers for genetic testing. And that is why we've started certain initiatives. I think it's really important to have partnerships with like community-led organizations, like Praises the Cure, Babashi, some of these organizations that have been really focused on providing like resources and care to the Black community specifically. In terms of like reforms in the field, I am a white female and my field is primarily made of white females. So I think another thing that we need to do to address that is to have individuals of underrepresented minorities informed of these career options. And one of the ways we're actually doing it at the Vassar Center for BRCA is opening up a paid summer internship for somebody of underrepresented minorities, people of color, to gain experience and access to the field of genetic counseling. But that's a huge thing, is individuals want to be cared for by someone who looks like them, and that's just a reality. So I think that's one of the ways we can kind of help reduce some of these disparities as well.
Yeah, that makes a lot of sense. And I know I said that was the last question, and I apologize to Michelle Bank in the chat who asked a question that I looked over. So this will be our last question of the night. And I think the answer will be on theme for the night, which is that a lot of these are personal decisions. But Michelle asked if there's a rule of thumb when it comes to having children when you know you carry a BRCA genetic mutation. Should BRCA carriers be considering in vitro or IVF as a preventative measure, or is it okay to conceive naturally, as Lewis and his wife decided to do?
And this is directed to me, correct?
Yeah, they're all for you, Kelsey.
Yeah. So yeah, it is okay. I mean, everybody's family is, and what they want for a family is going to be different. So it's absolutely okay to take different steps in order to make that happen. And certainly naturally conceiving, if possible, is definitely like a fun and less expensive way to do that. But in vitro fertilization with pre-implantation genetic testing might be a better option for someone as well. And it's just really dependent on the person. There's also adoption and the option of not having children. So these are all things that are going to be dependent, on the person and the person in front of you.
Sure, absolutely. And I think we might have a couple of Vassar blog posts related to family planning and fertility. Don't quote me on that, but you can definitely check out our blog. And on that note, I want to thank everybody who attended this wonderful panel. Also, if our panelists will drop their emails into the chat, we've all agreed to give you guys our email addresses in case you have any follow-up questions or concerns. Kelsey will also be answering any follow-up questions in some recorded videos, and you will all receive a recording of this event if you'd like to refer back to it. And you can always touch base with Carolyn Brown, who leads the Vassar YLC group, and we can get you joining, get you part of this group, participate in more events like this. And you could always submit ideas for blog posts or events and just general questions that you might have. We're absolutely here to help and serve. So thank you, everyone. I'm going to drop my email in the chat before this all closes out. And yeah, enjoy your evenings. Thank you for participating in this.